a younger age, that the constantly, 20 drags off of a cigarette and reburning and reburning and reburning, of course you're going to cough it up, because you've done all that damage for so many years.
Yeah, where's it going
And
to
all
go?
that burnt stuff's got to come out somewhere. It doesn't just dissipate. So,
Let's go back to coping with withdrawal
mhm.
and, for example, nicotine replacement treatments
Mhm.
and the different ones.
Okay.
From what I've heard of, the patch,
Mhm.
the lozengers, the inhalers,
Yep.
Chantix,
Yep.
prescription and non-prescription.
Okay, we can go through those. With our program, we're able to offer patches, gum, or lozenge to our participants that come through the program, and we give them anywhere from 4 to 6 weeks of these products. They're all over the counter. Not that we push one medication over the other. It's an interviewing process to find out, an eligibility form is required with the program, to find out exactly what's going to work best for them. And just because we have these products doesn't mean this is absolutely the product that's going to work for you.
Sure.
If they come so far to find me, they're halfway there. So I want them to really think about what product's going to work best so that this is a quit, not an attempt. Okay? I also highly recommend that they speak with their healthcare provider. Okay? We're just meeting for the first time. I'd rather they talk to someone who knows their history. So the other nicotine replacements that are available is the nicotine inhaler, which is a prescription. There's Chantix, of course, which is not a nicotine replacement, but that's the new drug put out by Pfizer. There's nasal spray.
Okay.
There's Zyban, Wellbutrin. Those are all prescriptions. And we covered the patch, the gum, and the lozenge.
How do they differ?
Well, the patch, for example, is a 24-hour deliverable system. You
Okay.
put it on in the morning, and it's with you till the next morning. Whether you take it off or not, the nicotine is in your bloodstream, and you get a constant, steady stream, depending on how much you smoke, what
Okay.
dosage you take. It's painless. You apply it to the skin, and you forget about it and go. Some people experience nightmares with it.
I've heard a lot about that. They don't wear it
That's
to
the
bed.
most common. And when I quit, I took it off just before bed, an hour before bedtime, because I experienced the nightmares. The gum and the lozenge are used pretty much the same way. The gum you chew a couple times to get it into gum form, and then you park it between your cheek and gum, the same with the lozenge.
Okay.
And the nicotine is absorbed through the membrane in your mouth. A craving hits you, and you either chew the gum a couple times to release a little more nicotine, and then park it again, and the same with the lozenge. Just wet it again a couple times, park it back in your cheek and gum. And you keep it there during the cravings is when you use that. The nicotine inhaler, I used that when I quit in combination with the patch. I was a 2.5 pack a day smoker, so I used multiple nicotine replacements. And I used it for cravings and emergencies. It was an immediate dose of nicotine that went straight to my brain, an immediate fix for me. And it's a plastic cigarette,
Okay.
so it filled that hand-to-mouth void
Sure.
that at 2.5 packs was a pretty common occurrence for me. And then what else do we have? The Zyban and Wellbutrin. They use that for 10 days prior to quitting. And then at the 10-day mark is when they stop quitting, so they can use that a little bit before. It's also a mild antidepressant. And then there's the Chantix, which is a nicotine blocker. And people are experiencing good progress with that. In my groups, and just mine, I have about 14 facilitators that work for me. It gets like a 50-50 rating. Some people can tolerate it, and some people can't. The most common discouragement with the Chantix is the nausea and vomiting. Although if they cut down to a half dose, some people can tolerate that better. So,
What are some things I was looking at your website and explain to our viewers the 6 Ds
okay.
that can assist you in stopping and staying stopped.
Okay. The 6 Ds are used in our program to the letter. The first